welcome back to Jenean's Journey. Yes, that's the thing. Get with it. I am loving bringing you guys along my life journey right now, and so I hope you guys are enjoying it as well. Thank you for clicking on today's video, and as you can tell by the title, I have some more tips for you. So as you all know, I'm a pediatric registered nurse, and I am studying now to be a pediatric primary care nurse practitioner. So right now I am working in pediatrics, but living the scrub life, hashtag PICU, hashtag pediatrics. So as you guys already know, I love being a nurse, and even more I love being a pediatric nurse. So the next step is to be a pediatric nurse practitioner. But you clicked on this video because you're trying to learn how to successfully pass the NCLEX so that you could become whatever type of nurse you want to be, and eventually maybe you want to be a nurse practitioner as well. So today I have a bunch of tips for you on how to successfully pass the NCLEX. I passed the NCLEX in 75 questions. Yes, 75 questions. And when you take the NCLEX, your nerves are already on 1,000. And when you pass the 75 questions, or just whenever you're done with the test period, it just shuts off. And so the way the NCLEX is, you can pass, well, now with the coronavirus pandemic going on, they have lowered the passing score, or the passing the least amount of questions, to 60, and I think it's now 165 is the max. But originally it's 75 questions at the minimum, 265 at the max, and you can either get 75 anywhere in between, or you can take all 265s. And so as you're answering questions, the way the NCLEX works is, as you're answering questions, it's grading you from the very first question to the next question. So if you do good, it's like, okay, it's like imagine this is an imaginary line. I maybe just put one here. I'm working on my editing skills. So imagine we have a line here, and so you start the test and you get them right, and then you may start getting them wrong. So they're gonna, based on those statistics of how you're answering the question, is how they're going to determine how many questions you end up taking. So if you do enough right above the line, then you could stop at 75 like me. If you get too many below the line, you can end up getting all 265 questions. So I am just going to give you a few tips on how to successfully pass the NCLEX, which is our national licensure board. I have some tips to help you successfully pass the NCLEX, which is our national certification to become a registered nurse. So after you pass nursing school, the nursing school is going to send to the state board that you qualify to sit down for your national licensure, and then from there you can schedule to take your NCLEX. And so I'm going to give you a few tips. I have my handy dandy iPad here. I don't have these in any particular order. They are all, I feel like, as important as the first one, as important as the last one. And every step I'm going to give you here, I feel like, is of importance, and you should just follow all these steps if this is what works for you as far as studying. And as always, I know we all study differently. I know what works for me may not work for you, and vice versa. What works for you may not work for me. I'm really a visual person. So if you follow me on Instagram, and you should follow me, Jenean's Journey, on Instagram. And I am right now in school, and I post a lot of things in my stories on how I study. I just recently took a test, and I use dry erase markers to write on my shower, to write on my mirrors, to write on anything glass that can be easily erased using dry erase markers. I use concept maps. Concept maps are a big thing for us nurses and nursing school, or us nursing students in nursing school. Charts, graphs, just making sure you do what works for you. So my first tip is, tip 1 is going to be, make a strict study schedule and stick to it. So point blank, period. Whatever you decide are going to be your study days, and however long you decide that you're going to study, just make sure you stick to that strict study schedule, because that is going to be vital to making sure you're studying and preparing for the NCLEX. Tip number 2 is take a prep course. I took a prep course. I actually won a prep course. I went to nursing school in Maryland, by the way, and I currently live in Florida. But I went to nursing school in Maryland, and I was a part of the Student Nurse Association, and I won a free Kaplan course at one of our student nurse conferences that I went to. So I didn't hear a lot of great things about Kaplan, but I took a Kaplan course because it was free, and you know that these prep courses can be pretty expensive. They can be $500 or more. And I took the Kaplan course, and I'm so glad I did, because nursing school is going to teach you everything you need to know to be a nurse, but the prep courses are going to teach you content in addition to how to answer questions the right way. As you know, these are all correct. It's about which one is the most correct. So being able to take a prep course and then they show you how to correctly think through a question is really, really helpful. So I would suggest a prep course. Hearst has a prep course. Kaplan has a prep course. HESI has a prep course. Just look into prep courses in your area for the NCLEX, and I'm pretty sure you can find something. Tip number 3 is take a break after graduation. Before you set this strict study schedule and before you get started on going from school to the NCLEX, I suggest taking a break. I took a 2-week break after I graduated from school. My mom was so gracious enough, thanks Mom, I'm not sure if you're watching this video, but thank you, to give me a 2-week trip to Europe. We did 7 days in Paris, 7 days in London, and that trip was amazing. I know my favorite word. It was so amazing, and it was my first time to Europe. I'm not gonna say out of the country because I've been to Mexico before that, into the Bahamas, but it was my first time visiting Europe, and it was a delight. And I also was able to Disneyland Paris. How exciting is that? You guys know I love Disney, and I went to Disneyland Paris. But before I go off on too much of a tangent, I will say stay tuned, because in June I'm going to be doing Flashback Fridays, and I did vlog. That was the very first time vlogging. Actually, I did vlog our European vacation, the adventures of S&J, Sylvia and Jenean. So be on the lookout for those videos coming in June. Flashback Friday, every Friday in June. It's gonna be me showing you guys my first time vlogging, which is pretty cool. So take a break, kind of get your mind out of school mode. All right, tip number 4. When I say study, I mean answering questions. So I would pick a set number of questions to answer every day and stick to that goal. So once again, sticking to that strict study schedule. Pick a number of questions to answer that day and stick to it, and answer that amount of questions, whether it be 50 to 100, just making sure you're answering questions every day. I really feel like if you're answering questions every day up until the day that you take your NCLEX, you're going to be better prepared. So a tip that I got from a fellow nursing school friend was to not share your test date. Don't talk about this test day. Don't talk about when it is, because what's going to happen is you're going to go tell Susie and Lisa that, hey, I'm getting ready to take my test on April 22nd, and they're going to be asking you all the way up until April 22nd. Are you ready? Are you prepared? Are you nervous? Everybody's going to call you on April 21st. And it's just going to be too much stress. So just tell people you finished nursing school, you're taking a test soon. And I was asking this one nursing student when she was going to take her test. It's just like, I'm not going to tell you. I was like, you know what? I don't even know why I asked, because I didn't tell. I think the only person I told was my mom when my testing date was. And I think that was just about it. So it was a superstition of mine. Not that you have to do it, but just so that you don't have that extra layer of stress, that extra layer of being nervous, that extra layer of having to talk about it so frequently. Just politely decline to tell people that you're not going to tell them when you're taking a test. So I went. Tip number 6, we're on tip number 6 now. So tip number 6 has to do with you actually going to take the test. So now it's time to take the test. So what you need to do is relax. When you walk into that testing center, relax. Do whatever you need to do the night before, get a good night's sleep, make sure you eat breakfast that next morning, and then as you're walking into that testing center, go in with a clear mind, clear heart, and just be as relaxed as possible. I know this is a really important test and it's a really important time in your life, but what you need to do is make sure you relax, okay? Tip number 7 is read the question slowly and thoroughly, and then read it again. What you want to do, I already told you to relax before you walked in. So now we're taking the test. You need to make sure you're reading the question, reading the root of the question, and breaking down what is this question asking me. Read it thoroughly and slowly, and then read it again. When you're reading that question, you're asking yourself, what is this really asking me? Is it asking me about ABCs, airway, breathing, circulation? Is it asking me about delegation? So if it's asking you about delegation, who are you delegating to? And is this something that this licensed personnel is able to do? So making sure you're reading the question and thinking to yourself, what is this asking me? Is this asking me something about the nursing process? Remember, ADPI, assessment, diagnosing, plan, implementation, evaluation. And also, is it asking you about Maslow's hierarchy of needs? How do you prioritize this patient? Which patient do you see first? Do I see the patient who is having an airway problem? Do I see the patient first who is just having an emotional crisis problem? Hierarchy of needs as well when you're thinking about what is this question asking me? Is it asking you something about Maslow's hierarchy of needs? Questions. Reread the question slowly and thoroughly. Okay. Number 8. What do we have for number 8? Number 8. Take your time. What you need to do is focus on those questions. What did I just say before? Focus, relax, focus, and reread those questions. Don't worry about the time. I'll hope to pass the 75 questions, but it's okay if you don't. It is okay if you don't. So please take your time and do not worry about the time. That is it. I only have 8 tips for you because you're going to do all these things and you're going to pass. You check out Picmonic, their YouTube channel and the app as well. The YouTube channel, if you go there, they have lots of videos to help you prepare for the NCLEX. They're showing you how to break down the questions. So they're actually going to give you some questions and help you break it down. And so you can do this. I have faith in you. You're going to rock this. You're going to pass the NCLEX and you're going to join me. I'm here for you if you have any questions. If you have any questions about this video or any questions about how to pass nursing school, I'll link that video above. Any questions about Picmonic, I'll link those 2 videos as well. I've done tutorials on Picmonic and on how to study to pass nursing school, and pretty much it's almost the same concept as passing nursing school. You want to be sure you're focusing and you're answering questions, and that's mainly the key for the NCLEX, is answering those questions and remembering the nursing process, remembering 5 patient rights if it comes to medication, remember Maslow's hierarchy of needs, remembering ABCs, airway, breathing, circulation, what do you do first, and delegation, because they do ask about delegating. You want to make sure you're delegating the right task to the right person. So I really hope this video helped you. If it did, make sure you give this video a thumbs up. Make sure you leave me a comment below. And as always, please subscribe to Jenean's Journey. And make sure you turn your bell notifications on so you can be notified of each and every upload. All this month in May is going to be all nursing related videos, as it is Nurses Week this month. And we're going to celebrate being nurses, being nursing students, and everything that comes with it, because like I said, I love being a nurse, and I just want to I hope you guys understand how much I love nursing and how passionate I am about it. And I just want to pass on some helpful information that has worked for me personally, and hopefully I can inspire the next nursing student and hopefully help you along in your nursing journey as well. So always, thank you for watching.